So now when you look at the prescription, what's the first thing you look at? If this prescription is legal or not. You can see the doctor's name is here, and the doctor details, the clinic details, the phone number of the doctor, and the fax number, the doctor's medical number. So is here, the patient's name is here, the patient's details are here, the patient's date of birth, sorry, the patient's age, the date of the prescription is current, and the patient address is there. So this patient is from Azizia, from Al Azizia in Makkah, and there's a doctor's signature here as well, and the date is current as well. So you have to quickly look at these things to make sure that that your prescription is legal. And later on you may get some exercises in which any of these information is missing, or the date is very old, which means the prescription is very old. So you have to decide whether you can dispense that prescription or not, or you also will have the option to say no to the patient, that I cannot. So I can quickly see that all the things are there, and the prescription is legal. Now let's see what the doctor has prescribed. So the doctor has prescribed Norvasc 5 milligram tablet, 1 tablet BID, and 60 tablets for 1 month supply. RPT 0, that means no repeat. So that means this is just a one-off prescription, and the patient cannot bring this prescription again. If the patient wants more medicine, then the patient will have to bring a new prescription. So I know from my knowledge that Norvasc is a brand name. It's an amlodipine, and the generic is amlodipine. Now, if you're not sure of that, what generic it is, or now if you're not sure what the medicine is about, or anything you want to find out about the medicine, you need to go to the references. So if you look at the references, so these are the references by default here given: Micromedics, Up to Date, and California State Board of Pharmacy. So these are the link to the references by default given here, but unfortunately we do not have access to any of these references. So what I have done here for the sake of this exercise is I have already given an attachment. If you remember the attachment I talked about in the beginning, it was here. So I've already given an attachment here, which means that you might need to consult it for something if you're not sure about. So if you click on this attachment, and if you click on here, you will see amlodipine drug monograph will appear from the lexicon, which I have already uploaded on the system. So you can figure out that Norvasc is the brand name and amlodipine is the generic name of that. The other thing you can quickly check is the dose and frequency, if that is correct for the patient's condition. So you can see that amlodipine can be given in stable angina, in hypertension, and Raynaud's phenomenon as an off-label use. So what condition the patient has. So if you recall, I have not asked what the condition the patient has, so I can always go back and ask the patient. So let's just go back, close this, go to the fact finding again, and let's see if there is an option to ask the patient about this. So yes, there is a purpose of medication. So I ask the patient, do you know what this medication is for? Yeah, and the patient says it's prescribed for the blood pressure. So I can go to my reference again and quickly see the dose and the frequency, to check the dose and the frequency if I'm not sure about. So you can see for the hypertension, the initial dose should be 2.5 to 5 milligrams, and once daily. And it can be given up to 10 milligram per day. So the dose can be started from 2.5 and 5 and can go up to 10 milligram, and it's given as once daily. Now straight away, one thing you should note is that the doctor has prescribed twice a day. So that means it's a problem in the prescription. So the dose may be correct. It's a 5 milligrams starting dose, but the dose is prescribed twice a day. So I might need to go back and check with the doctor, because the doctor may have his own reason why he has prescribed a tablet which should be given once a day. Or maybe the doctor didn't know about it, so I can talk to the doctor and get it changed on the prescription. So how do I contact the doctor? You can close this conversation with the patient, pick up the phone, and try and contacting the doctor. I forgot what the name of the doctor. The name of the doctor was Dr. Hani, and you can see he's got his signature here as well. So let's just minimize this prescription, pick up the phone, and you will see that the doctors are listed here. I will see if Dr. Hani is in the list. Yes, Dr. Hani Khoja is here, and if you click on that, straight away the doctor picks up the phone and he says, I'm rather busy, so please make this call quick. So the doctor is saying this, that he's very busy and he wants a very brief conversation. So I continue with this. You can see from this screen that I'm in conversation with the doctor now, and these are the things which I can ask the doctor. So again, you have to learn to ask the relevant things from the doctor. Do not just ask the random questions, and later on you may get negative marking for that. And this interface with the doctor is not designed for the professional conversation, because the purpose of this exercise, especially with the doctor, is conversation with the doctor is not to train you on communication skills. So this is not designed to how to start the conversation with the doctor and what wording you would use with the doctor. It just gives a list of information which you're asking from the doctor. So I can ask the doctor about the dosing query, because the starting doses actually can be 2.5 as well, but the doctor has started with the 5 milligrams. So I can just ask the doctor, because I'm in conversation with the doctor, and the doctor says the dose is appropriate for this patient, so that's fine. The most important thing I want to talk to the doctor about is about frequency query. So I have to say to the doctor that it's not given according to the lexicon monograph, it's given as once daily, but you have prescribed twice. So if you click on that, the doctor replies, fine, change it to once daily and explain it to the patient. So that's what I wanted. So the doctor he has asked me to change on the prescription and explain to the patient, and then I can end the call with the doctor. So click on end, and you can, this telephone interface, you can minimize that. Okay, so I have talked with the doctor, and the doctor has confirmed that he wants me to change the frequency to once a day. So as a pharmacist, bring up the prescription. As a pharmacist, what you need to do is you need to make a note or annotate or literally write on the prescription that you're going to change the frequency, that you have talked to the doctor and the doctor has agreed to change on the frequency. So how do I write on this prescription? So this, remember this little icon we talked about in the beginning. So this, if you click on here, this will pop up, and these are the things which you can change on the prescription. So if you can see, you can change the date on the prescription as a pharmacist. You can change the patient details, you can change the prescriber details, you can change the medicine details. So I want to change the medicine details. I want to change the frequency. Frequency will be under directions. So if you click on directions, I can write here once. So I can write here 1 tablet once daily. I should also write here that I have talked to the doctor, and I can write the date and the time when I talk to the doctor, so just to be on the safe side. So where is this appearing? You can see this is appearing here on the prescription, but I want it to be here. So you can see here I have annotated, like literally written on the prescription, that 1 tablet once a day. I have crossed out 1 tablet twice a day, and I have written 1 tablet once a day, and I have talked to the doctor on 14 June 11 a.m. The other thing which is important to note on this prescription is that the doctor wanted, I can see the doctor wanted to prescribe for 1 month, and that's why, and it was twice a day, so that's why the doctor ordered for 60. So but now the doctor has asked me to change it to once a day, so 1 month supply will be 30. So I should also change 60 to 30. How can I do that? There is an option for quantity here. If you click on quantity, that will appear, and I can write as 30. You can see 60 has been crossed out, and I have written 30, and it has appeared here. I can just bring close to this, and that's it. So I have annotated the prescription. Now remember that later on, when you will get the prescription exercises, it may be that there is nothing wrong in the prescription. The prescription is legally correct, and there is no clinical problems in the prescription, and you just have to go ahead and dispense the medication to the patient with correct counseling. So I have done everything on the prescription, and then I can close this. Do not reset. Do not click on reset. Reset means that everything will disappear, which we have written here. So let's just make this disappear and minimize the prescription. So I have got everything sorted on the prescription, and I'm sure that every prescription is legally correct and clinically correct now. And as I said, that for future exercises, maybe there is no legal or maybe there is no legal or no clinical problem in the prescription. So you just have to go ahead and do your normal dispensing procedure and hand it to the patient. So now the next thing you do is you have to enter the information in the computer system and generate or print a label. So if you click on computer, you can see the computer screen will come up. And here you will enter all the relevant information in the computer, which will also help you generate or print the label, which you will stick on the medicine box to give it to the patient. So I have to write patient name. So you can see patient name was Abdullah. So if I can write just the first 3 letters or 3 or 4 letters in the box and then hit enter, you will see it is already giving me the options to select from. This is my patient, Abdullah Al-Harbi, is from Azizia, is 35, male, and is a male patient. So you can see the patient, actually the patient details are already in the system. So I can select that. Because this scenario is set up that the patient is coming from to a medical center or an outpatient clinic, so that means the patient details were already in the system. So I just selected those details. And in the same way, the doctor's details will also be in the system. In future, maybe you will get some exercises where the patient comes in and the patient is not in the system, so you have to manually enter all the details of the patient. Later on, you may also have some exercises which are OTC exercises, which means the patient will come in just complaining about something without any prescription. So you will have to see what products you have or you can recommend to that patient. So coming back to this, I have entered my patient details. You can see Abdullah Al-Harbi, 35 years of age, and his address is correct. So as I said, I didn't have to enter manually the patient details because the patient details were already in the system.